I once had a patient that, due to a simple mistake, ended up getting a bill in the mail for over $1,000. And what made me feel worse about it is it was my fault. And the scariest thing about what happened to him is that just as easily it can happen to you if you're not careful. So in this video, we're not only going to go over how you can avoid the surprise charge, but 4 other simple steps that you should be doing right now that can save you thousands of dollars on your medical bills. Now, I'm sure that you're wanting to know how I cost that patient over $1,000, and I'm going to get to that in just a minute. But first, I want to help you save a ton of money by making sure that you avoid these big mistakes. More and more these days, a lot of doctors are affiliated with hospital systems, and because of that, they want to do their labs or imaging studies at the hospitals. It's easier for the doctor to get the results, but also, of course, it makes the hospital more money. So the problem is the hospital systems frequently charge 4 to 5 times the amount that you would get charged if you go to an independent outpatient facility. I'll give you a personal example that happened to me. A while back, my son had some issues with pain in his shins. He's a runner, and we needed to do an evaluation for any evidence of stress fractures. Well, I was in a hurry, so I just sent him downstairs to the hospital to get it done instead of a local independent facility. I have a high deductible insurance plan, so to my surprise, when I got the bill, it was $300 just for the x-ray, and then $35 for the radiologist to read it. If I had sent him to the local outpatient imaging center, it would only cost me $65, including the read from the radiologist. In our own practice, we recently started an outpatient imaging center. Because of that, we're able to charge significantly less than the hospitals. I'll show you our charges because it's pretty consistent with what you can find in your area. Look at the difference in prices for some of these studies. For example, in the hospital, if you get a chest x-ray, it's going to cost you over $200, and that doesn't include the radiologist read. But if you go get it done at our place, $69, or if you even just pay cash for it, $65. But even more importantly, look at some of these bigger studies, like a CT of the chest. It's going to cost you $2,000 if you do it with contrast in the hospital. If you cash pay at our place, $425. If you're getting an MRI of your back, almost $3,000 at the hospital. And if you pay cash for it here, $750. This is a huge difference. If you have a high deductible plan, or especially no insurance, don't ever go to a hospital for these kind of studies. They're so expensive. Heck, even if you have insurance, don't go to a hospital for these studies because even if it isn't coming out of your own pocket, it's costing all of us more through higher insurance premiums. Now, the same holds true if you go get lab work. The price you pay for labs to be done at a hospital versus an independent lab can be significantly different and save you a ton of money. Now, let me show you a little secret. You can actually negotiate these prices with the hospitals. If you don't have insurance or you're not using insurance, don't be afraid to negotiate your bill for your imaging, labs, or any other care that you receive. Very often, if you call the business department, you can get money knocked off your bill. This next hint can save you thousands of dollars over the year. If you have great prescription coverage on your insurance, this may not be as important, but for many of us, either without insurance or a high deductible plan, if you find yourself in this category, look for a prescription drug savings card. There are several companies out there. Some of the most common are GoodRx, WellRx, Single Care, Prescription Saver, Cost Plus Drugs. There are actually quite a few out there. Our family uses GoodRx all the time, and no, they're not sponsoring this video in any way. But we use them because it's super convenient to comparison shop in our area to find the best price since we never meet our deductible in our insurance. Most of these companies work the same way, where you type in the medication that you're looking for, you search the local area for the best price, then you either print off the coupon or just take the app on your phone and the prescription to the pharmacy and they'll give it to you for that price. If you have a pharmacy that you like, but they're too expensive, you can also use it to try and negotiate a better price from your own pharmacy. Now, where these plans struggle are with some name brand medications. No matter what, name brand, non-generic medications are going to be expensive. Usually these kind of cards won't make a huge difference in your cost. So if you're needing to save on those type of prescriptions, you need to look into manufacturers' coupons, patient assistance programs, or I've even had patients go to Canada or use Canadian pharmacies to get better prices. If you're going to look into doing this though, I'd recommend you talk to your doctor on how best to do this. So now for the way that I messed up and cost my patient over $1,000. I had a patient come in for what I remember was a mole removal. We took it out, put it in the specimen cup to send it to the pathologist. Our group had a pathologist that we would always send our biopsies to. Well, it turned out that the pathologist was not in the network of the patient. I had no idea, and the patient had no idea, but they ended up having to run some specialized tests on it that made the evaluation cost even a lot more. Unfortunately, because none of this was done by his network provider, they didn't cover any of it. He ended up coming in a few months later for something else and told me about it. Now, fortunately, he was nice and forgiving about it, but I felt so bad that unbeknownst to either of us, he ended up having to pay off a big bill that was totally unnecessary. So, if you want to avoid a large charge, unexpected medical bills. Make sure that you're getting your care done at a provider who's in your network. Now, most people are used to doing this for the doctor themselves, but never even think about the care like labs or pathology that your doctor uses that may not be in your network. So if your doctor sends you to get a study at a place or to a specific referral, more often than not, they're not going to have any idea if that provider or that place they're sending to you is in your network. So before you do any care, or you have a doctor do care for you, verify with your insurance that everyone you are using is in network. Now, the fourth recommendation also has to deal with where you get your care. Now, this is especially important after normal working hours. If you can't get into your doctor either during the day or after hours, and it's for an appropriate condition, try to go to an urgent care center instead of going to the emergency room. This can result in thousands of dollars in savings. Now, the purpose of this video is not to tell you when it's appropriate or not to go to the ER. I don't know your situation. What I'm going to tell you is that the majority of patients seen in the emergency room don't need to be there. In fact, a recent analysis showed that 71% of the visits to the emergency room were unnecessary and could have been cared for at an urgent care or the next day at their doctor's office. Now, I'm not talking about heart attacks or breathing difficulties. I'm talking about the late night visits for a cold or earache symptoms that tend to plug up the emergency rooms. If you're wondering where you should go in your own situation, call your doctor's office. Or sometimes your insurance has a nurse triage line that can help guide you on whether it's necessary for you to go to the emergency room. A lot of the time, things can wait until the next day. So take advantage of whoever's on call and get their advice on the best place to go. Going to the emergency room instead of urgent care for an unnecessary visit can cost you thousands of dollars more that you just don't need to spend. Now, the fifth suggestion that I'm going to give you has the potential to save you the most out of all the things that we've talked about today. In fact, if you implement this one thing, you could potentially save hundreds of thousands of dollars in the future. Now, I hope I have your attention. In order to save this kind of money, all you have to do is simply find yourself a good primary care doctor. That's right. Having a good primary care doctor who takes an interest in your overall health is the best way to be able to avoid many of the costly conditions that you can be faced with. So why would that be? Well, first of all, in my specialty of family medicine, we're trained to focus on prevention. Prevention through healthy eating, activity levels, cancer prevention, diabetes prevention, and so on. Having a visit with your family doctor once a year and making sure your preventative care is in order is time and money well spent. It's certainly easy to pay for a physical than it is for a lengthy cancer treatment that could have been prevented. Also, family medicine or primary care doctors are trained in the breadth of medical specialties. For certain, I'm not a neurologist or a surgeon, but we do treat most conditions and can best tell when it's important that you see a specialist and when likely it's not necessary. Specialists are more expensive and their tests are more expensive. When you go to see a specialist first, you're more likely to get a lot of specialized testing that's a lot more expensive and maybe unnecessary to begin with. We're trained in looking at the person as a whole and getting a better picture of what is going on in your health. And lastly, there's a great benefit in having a relationship with your own doctor. Urgent care clinics can be convenient, but you're also more likely to get more unnecessary studies and be inappropriately treated with antibiotics or other unnecessary treatments. When you have your own doctor that knows you, you will get better care and in the long run, save you money. So it's that simple. By getting things like labs and imaging studies at independent facilities, using prescription savings cards, making sure all your care is within your insurance network, staying away from the ER and getting yourself a primary care doctor can take what is an outrageously expensive industry and make it a little more user-friendly and cheaper for yourself. So now that I've saved you a ton of money, hopefully you can pay a little bit of it back by giving this video a like and sharing it with your friends. It really helps out our channel a lot. And if you have time or other ideas on ways that you've used to save you money in healthcare, let us know in the comments below. Another bonus way that you can save a lot of money is by getting rid of any lousy doctors that you're seeing. So if you need help in deciding if you need to fire your doctor, we'll give you some great pointers on when that may be necessary right up here. And for everybody else, we just want to thank you for joining us here at Family Med, and we hope to see you in the next video.